So we have those aspects of need: normative need, perceived need, express need. And what oral health needs assessments are about are trying to establish what is the unmet need. So the difference between what you're currently offering in terms of services or oral health promotion programs and what your population needs. So you're trying in your oral health needs assessment to identify unmet needs and then try and make some sort of action plan to address those needs. So the final aspect, unmet need, is what we're trying to actually to sort of address, identify and address. Any questions on Bradshaw's taxonomy? Okay. So, as we looked at the definition of oral health, of health needs assessments, it makes us think about the need for health versus the need for health care. And actually that's quite a tricky one to resolve in your mind. So if we identify that there is a need for health, there is a need to improve the health of a population, what sort of things are we thinking of that would address that?
Health?
Yeah.
Housing?
Yeah?
Housing? Employment?
Yeah.
Education?
Yeah. And if you were thinking about that in terms of oral health, what is the name that we give to programs that will attempt to try and tackle those things?
Like
Yeah, so it's a determinant. So what things do we use to try and improve oral health of the population? Health promotion, yes. So when you're doing your oral health needs assessment, if you're really trying to tackle unmet needs for health, you need to think about oral health promotion. If you want to think about unmet needs for health care, you're thinking about dental services. So an oral health needs assessment must have both. And typically what people do is they forget the oral health promotion and just think about the dental services. And you may remember that Tom and I'm sure Peter have talked about the contribution that dental services make to improving oral health is very small. So we mustn't forget that when we're thinking about oral health needs assessments, it's not just about get a few extra dentists and dental care professionals in, set up a new emergency dental service. Actually, to improve health, it might be things like campaigns to stop tobacco or ban use of tobacco in public places. Might be about advertising of sugary foods on children's televisions, those kinds of things. So don't forget, when you're thinking about oral health needs assessments and the name, when you come to the bit about need, we're thinking about Bradshaw's taxonomy, and we're thinking about need for oral health versus the need for oral health care. And make sure you have both. So the final word in the term is assessment. And again, as the definition suggested, it has to be a systematic assessment. It has to be something that we rigorously measure. Okay? So typically, because of the definition of oral health, it usually does include some sort of clinical assessment that either we carry out or we look at data that have already been collected. So if we don't have to carry out the survey, it may be we can use survey data that somebody else has collected. We need to think about the perceived need of the individual. So how might we do that? How do we assess what people, the impact that people's lives that oral health has on people's lives? Questionnaires? What kind of questionnaires?
Impact profile.
Yeah, so it might be an oral health quality of life questionnaire like the OHIP 14, something like that. Oh, you're good. Right. What about this is something we haven't touched on really. The propensity of the individual to take prevention, to actually uptake prevention. Actually, we did talk about this a bit last week. So when we do dental health education, as an example, who tends to take up those messages? Is it the really poor people with all the caries? No. Is it what we'd call maybe middle class people who have a kind of secure family lives with a good income and have their children's health as their top priority because they are, free to do that because of the lack of other pressures on their lives? Yes. So it's those people. So we do, when we are looking at our oral health needs assessment, need to take account of who we want to help and how we can help them in a way that fits in with their lives. And the next point is about how we can help them in a way that works and is acceptable to them. So that might be thinking about the evidence base for the effectiveness of interventions to reduce caries, for example. And then we need to think about, in terms of the services, what workforce and what skills do we have? And how can we use the skills of the workforce to its best ability to meet the needs of the population? So say if you have in your country fairly low levels of caries with a mean DMFT of about 1 or 2 in, maybe say 1 in 5-year-olds. If you think about the skill mix and what type of dental professional would work in that situation, what type of professionals do you know about that would be appropriate to work in that kind of level of dental caries in children, say? Dental nurses could be putting fluoride varnish on. Hygienists and therapists could be doing those small fillings. Yeah. So at low levels of disease, of caries particularly, actually the skill mix, the most appropriate skill mix then is perhaps to have a dentist heading the team and actually then directing work to therapists and dental nurses to provide prevention and to restore the caries in the children that have it. When you get to higher levels of disease, or when you're thinking about, say, an older population, so say if you were thinking about a group of 80-year-olds, what sort of skill mix might you need there?
Technologies.
Yeah, so you might need clinical dental technologists, yeah, to do all the denture work. Therapists could, they may do some fillings, yeah. Anything else? What about for the tricky patients that have got, say they've got a dry mouth, they're starting to get loads of caries, they've got some implants that are failing, they need some partial denture or some more implant retained lower denture. What sort of person would be providing that kind of care on somebody that's maybe got loads of medical problems? They'd probably need to be some kind of specialist, wouldn't they? So that, again, is an idea of how you think about the skills and the workforce you need based on what you identify as your unmet needs. But assessment of need depends on when you do it, where you are, and who is assessing it. So what type, thinking it back to Bradshaw's taxonomy, what type of need will a clinician or a dentist assess? Normative, yeah. What about the patient or the public? Yeah. What about a general investigator? Perhaps a researcher?
Unmet need.
Maybe. It may be that you use your investigator to go out and do interviews or focus groups to get some of the impact of on the individual. So yes, we need to, when we're doing our oral health needs assessments, typically we need to actually include people, not just one dentist doing it, but actually a group of people. And we usually have a panel of people that are stakeholders that are involved in oral health promotion, involved in service delivery, involved in the funding of services. We have patient representatives. We usually have somebody from dental public health. So typically we have a team of people that carry out the oral health needs assessments. And you carry out an assessment of a particular place or a particular group of the population at a certain time, knowing that actually in a couple of years' time you probably need to do it again. Okay?